Hi, I'm Dr. Chet Rihal, Chair of the Division of Cardiovascular Diseases at Mayo Clinic in Rochester, Minnesota. Today I have a very special guest with us. Dr. Amit Sood is a consultant in the Division of General Internal Medicine. Amit has a background in integrative medicine, stress management, and resiliency training, topics that I'm sure are relevant to many of us in day-to-day clinical practice. Amit, welcome.
Thank you.
Amit, maybe you could tell us, what are the causes of stress and burnout in medical practice?
Stressors abound, Chet, as you know. Life is full of stressors, but not every stressor translates into stress. There are really three characteristics of a stressor that convert them into a feeling of stress. One of them is demand-resource imbalance. Whenever you're perceiving that you have excessive demand and you're not able to meet that demand, you feel stressed. The second is lack of control. When things are in your control, you feel good about it. But when things are out of control, then you feel excessive stress. And finally is lack of meaning. If you hear somebody has lost a unit of blood, it doesn't sound good, but if they donated it, it is not as stressful. So it is demand-resource imbalance, lack of control, and lack of meaning that makes us stressed.
That's very insightful. Now, are we as physicians condemned to a life of stress, or are there things that we can do about this proactively?
Oh, we can absolutely do a lot about stress, and that is by cultivating what we call resilience. Resilience is your ability to withstand adversity, bounce back from adversity, and prevent and preempt adversity. Resilience has multiple characteristics. One of them is cognitive resilience, which is your ability to maintain attention, judgment, and decision making in the midst of a stressful situation. Second is physical resilience, which is your ability to maintain health and well-being. Then is emotional resilience, which is your ability to have a balanced, optimistic disposition through your life. And finally is spiritual resilience, which is keeping a higher meaning and altruistic perspective. So when we cultivate all these characteristics within us, we develop resilience.
So Amit, how do we actually cultivate these four important things you've mentioned? Is it possible to train for them, or tell us about the program you've set up here at Mayo in resiliency training?
Sure. We have a stress management and resilience training program where we help people learn, first of all, about their brain and mind, why our brain and mind that have a threat superiority effect, our instinct to pay attention to imperfections in life, why that generates a lot of stress. Based on that understanding, we help participants first train their attention so that they are more in the present moment, not lost as much in past and future. A lot of stress comes from us dwelling too much on past and future. So training attention is a key aspect, and I believe the first step towards developing resilience. Then we help them refine their interpretations using some of the higher principles. The core principles we have in our program are gratitude, compassion, acceptance, higher meaning, and forgiveness. So these two components, training our attention and refining interpretations together, help people be resilient. We have done several empirical studies to test our model and found that the intervention does enhance people's resilience.
So you've done scientific studies prospectively on participants in your program?
Yes, we have, and some of that data is already out published.
So we know it actually works, it just doesn't sound good, right?
That's right.
Yeah, good. So is this something that almost every physician would benefit from, or should we think about this only if we're feeling unduly stressed in our lives?
I think most physicians I have met, actually most patients or learners I have met, whoever is interested, willing, and has an open mind will be benefited by it.
Good, wonderful. Is there anything else you'd like to tell us about this program?
The program helps you really, it is not just about stress and resilience. The program helps you attain and achieve the highest level or highest goal that you are capable of. We call it walking towards self-actualization. It helps you understand what is the meaning of life, why am I here, what am I doing, and how can I leave Earth a little better than I found it. So it's not just about being happy or sleeping well. It's about affecting your lifestyle decisions, enhancing your relationships, improving your physical health, and cultivating deeper spirituality.
Our guest today has been Dr. Amit Sood from the Division of General Internal Medicine, who has given us a fascinating overview of stress, burnout, and what we can do about it with resiliency training. I hope that you have found this as fascinating as I have, and that it will be useful to you in your practice and to you personally. Amit, thank you very much for joining us.
Thank you.
Okay.